Senator Cruz, like most Republicans, has said that he wants to repeal the Affordable Care Act, or so-called Obamacare.
You know, 6 years ago, when Obamacare was being adopted, it's possible that reasonable minds could have differed on whether this was a good idea. But 6 years into it, we've seen the results. We remember Obamacare. A series of promises were made to us by President Obama. Number one, most infamously, if you like your plan, you can keep your plan. President Obama said that 37 different times. As 6 million people across this country discovered, that was not true when they had their plans canceled against their wishes. If you like your doctor, you can keep your doctor. Again, millions discovered that wasn't true. And President Obama promised the American people the average family's premiums would drop $2,500. Not only wasn't that true, but the average family's premiums have risen $5,000. That's why people are unhappy with this disaster of a law, because it's driven up the cost of health care. It's reduced your choice. It's reduced your freedom. And this last election was a referendum on Obamacare, and the American people quite rightly decided this plan isn't working.
It means that if you are one of 20 million Americans who finally has received health insurance, forget about it. You're gone. You're off health insurance.
This is an issue where Bernie Sanders and I have fundamentally different approaches. Bernie and the Democrats want government to control health care. I trust you, and I trust your doctors. I think health care works better when you're in charge of your family's health care decisions, when you can sit down with your doctor and decide the care that's best for your family without government setting rules, without government rationing, without wait periods. And that's the fundamental divide we're having.
The real question, which is never talked about or very rarely talked about, is why we end up spending as a nation twice as much per capita on health care as do the people of any other country. Now, if you were in Canada, you know what? You would get the health care that you needed. If you were in the UK, France, Germany, Scandinavia, you would get the health care you need as a right of being a citizen in this country.
And I will commend Bernie for his candor. I mean, his view all along was that we need government-run and government-controlled health care for everyone. And indeed, as he said here tonight, he thinks other countries do it a lot better than America. He often points to Canada, the United Kingdom. He says, why do we pay more? Well, there's a reason we pay more than those countries. We get a lot more and a lot better health care. Let me give you some basic facts. As I noticed in all the Democratic primary debates, there was no discussion of the facts on the other side. The United States, population controlled, delivers 3 times as many mammograms as Europe, 2.5 times the number of MRI scans, and 31% more C-sections. We provide more health care. Not only that, in the United Kingdom, for example, wait times. In 2013, you waited 72 days for cataract surgery. You waited 89 days for hip replacement, 95 days for knee replacement. There are 3.7 million people in the United Kingdom right now on a waiting list waiting for health care. Whenever you put government in charge of health care, what it means is they ration. They decide you get care and you don't. So let's talk about, for example, a couple of stories from the United Kingdom. In Glasgow, Scotland, the Queen Elizabeth University Hospital was so overburdened this past January, it turned away 3 women who were in labor because they couldn't take care of them. In Worcester, England, a man was left on an ambulance gurney for 5 hours before his heart attack was diagnosed. And he waited 7 hours before he received a stent and angioplasty. In a hospital in Essex, doctors twice canceled a potential life-saving surgery for a patient with esophageal cancer because there were no free beds in the intensive care unit. One more example in Wales. An 82-year-old woman who had fallen waited 8 hours on the floor before an ambulance arrived. Her daughter sat beside her in the ordeal, described it as one of the longest nights of our life. This is what happened when government takes over health care. Every example on earth. The result is rationing and waiting periods, and you, the citizens, being told, no, you can't have the health care you want and deserve.
What I have long supported within the context of Obamacare, as we move toward a Medicare for all single-payer program, is a public option. there should be a Medicare-type public option available in all exchanges in all states in this country.
Now, Bernie likes talking about a public option. That's another way of saying government control of your health care. It's socialized medicine, and what does it mean? Every country where it's been applied, you've seen rationing, you've seen government deciding, especially seniors. Seniors, you don't get the health care you need. Now, Bernie mentions Canada quite a bit. I know quite a bit about Canadian health care. I was born there. You know, Bernie, that may be the best argument against your position is you know, look what it produced.
Look at the results. Yeah, that's right. Let me give you an answer you will not be happy with. And that is, I think that for businesses that employ 50 people or more, given the nature of our dysfunctional healthcare system right now, where most people do get their health insurance through the places that they work, I'm sorry. I think that in America today, everybody should have health care. And if you have more than 50 people, you know what? I'm afraid to tell you, but I think you will have to provide health insurance.
So my question is, how do I do that without raising my prices to my customers or lowering wages to my employees?
You see, there may be somebody else in Fort Worth who is providing decent health insurance to their employees. And they are in an unfair competitive situation regarding you. You can compete and maybe charge lower prices, get business, while they, on the other hand, may be providing decent health insurance.
And, you know, I've got to say I've got a very different view than Bernie. I think actually what Bernie told you is the same thing President Obama said. It's the same thing Democrats have said, which is that you, the small business, you're apparently a bad actor because you're not allowed to manufacture money. You know, let me introduce you all to two terms that have become really common. 29ers and 49ers. 29ers are the millions of people across this country that have been forced into part-time work, that used to have full-time employment, and are now working 29 hours a week because Obamacare kicks in at 30 hours a week. And then 49ers. There are millions of small businesses in the exact situation you're in. You know, a couple of months ago, I was out in West Texas, was visiting a dairy farmer, driving around the dairy farm. I got to say, interesting smells on the dairy farm. Kind of reminds me of Washington. But the farmer brought up, he said, you know how many employees I have? I said, no. He said, I've got 49. He said, you know why I have 49? I said, yes, I do. Because Obamacare kicks in at 50, and he said, I could hire 20 or 30 more employees right now, but Obamacare would bankrupt my business, and that's millions of small businesses.
Ted, let me ask you a question.
Sure.
Is every American entitled, and I underlined that word, to health care as a right of being an American? Yes or no?
You know, I'm glad you asked that. You know, right is a word you use a lot. Let's talk about what rights are. Rights mean you have a right for government not to mess with you, for government not to do things with you. If you look at the Bill of Rights, the Bill of Rights, free speech means the government can't silence you when you're speaking. Religious liberty means the government can't control who you worship, what your faith is. The Second Amendment means the government can't take away your guns. Those are rights. You know what the Declaration of Independence said? We hold these truths to be self-evident, that all men are created equal and that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. So what is a right? Is access to health care. What is a right is choosing your own doctor. And if you believe health care is a right, why on earth did you help write Obamacare that caused 6 million people to have their health insurance canceled, that had them lose their doctors, and have people like LaRonda who can't get health insurance, can't afford premiums? You're denying her what you say is her right. You know, I'd like to take a minute and actually ask the people here, if the cameras could turn for a moment to the folks in the audience. I want to ask you, how many of you here in the last 6 years have seen your health insurance premiums or your deductibles go up? Let me ask another question. How many of you here know somebody, including yourself, who's had your insurance policy canceled in the last 6 years? If you look at these hands across the room, this is why people are so unhappy with Obamacare. Because it isn't working. Because it was built on an edifice of lies. And Bernie's solution, you know, I'm reminded of an old Saturday Night Live skit with Christopher Walken, where they're playing in a band and he keeps ringing the cowbell. And every time they record it, his solution is more cowbell, more cowbell. It was government control that messed this all up. And Bernie and the Democrats' solution is more cowbell, more cowbell. Yeah, it didn't work when we said you wouldn't get your plan canceled. Yeah, it didn't work when we said your premiums would be cut. But give government even more power. We can do better. I believe we're going to honor the promises we made to the American people, and we're going to repeal what Bill Clinton called Obamacare the craziest law in the world. Instead, we're going to give you choice, let you buy insurance across state lines, expand health savings account, make insurance portable, block grant Medicaid to the states so you can have experimentation health savings accounts so we can meet your needs, put you in charge of your health care with your doctor, not government. You're right that choices have gone down dramatically. Indeed, I don't know if the cameras can see this, but in 70% of the counties in America, on Obamacare exchanges, you have a choice of 1 or 2 health insurance plans. That's it. 70% of the counties in America. It's interesting, you look at this map, this also very much looks like the electoral map that elected Donald Trump. It's really quite striking that the communities that have been hammered by this disaster of a law said enough already.